Pharmacists were always the ones that provide medication, and they were the ones who helped you feel better. When you were a kid, you go to the doctor, they give you shots, they gave you needles, they poked, they prodded, they stuck things down your throat. The pharmacist gave you bubble gum amoxicillin, and you felt better in days. So they were the member of the healthcare team that I saw as they were the ones who really helped. I was spending the day in an assisted living facility doing a 6-month medication review, which is required here in the state of Maryland for patients who have 9 or more medications. So they're fairly complex. This particular patient was receiving several medications that had to do with her blood pressure and her pulse. And she was actually getting her blood pressure taken 6 times a day when they were administering medications 6 different times. And she has a fairly advanced case of dementia, and this was not an easy task for her to understand, and it was not an easy task for the healthcare workers in the home. So we took her medications and we consulted with her cardiologist and her primary care doctor, and we got her down to where she only needed to have that happen 2 or 3 times a day, which was much more acceptable for everyone. Pharmacists should be recognized as providers because we were trained as the medication experts. I went to school 8 years, so I have advanced training in medications and how they work, and as we switch from the fee-for-service model, it'll be very important to prove outcomes for these patients. And we are the ones with medications that can help patients and guide them on a monthly basis when we see them to make sure that they're achieving those outcomes. So we need provider status so we can make that happen.